I hear so much focus on equity and health equity. Health equity, it's the opportunity to achieve the highest level of health, the highest state of health. And I just gave a talk recently in my hometown in East Orange, New Jersey, and we're talking about how do we revive the village? How do we revive the community? And what stuck in my spirit the most was that we can't ask communities to be revived if we're still sending them home to concentrated poverty. If we're still sending them home to environments that create a toxicity, environments that create a burden, a degree of stressors that then predict or precipitate or encourage or determine or shape or influence certain outcomes. Because then are we truly reviving the village? Or are we just maintaining the status quo? And if I posit anything today is how can we move from maintaining the status quo of the work that we do to disrupting the world in which we live and the world which houses our work? So you see this graphic. I won't spend too much time on it, but I just want you to focus on two aspects of the graphic. You all know what an inequality is. It's obvious, right? It's obvious that there's a tree, that tree is leaning in one direction. It's obvious. It's obvious that there's less fruit on one side of that tree. It's obvious that there are two different people, representative, if you will, of two different communities on two different geographic sides of that fruit. That's all obvious. It's also obvious that if we talk about equality and I give them both a ladder, that somebody is still a loser in this caste system. Think about all the interventions and the tools and the strategies that are our ladders. That's obvious. It's obvious that those ladders are of equal height. It's obvious. It's obvious that there's still less fruit on one side of the tree. It's obvious. Then we get to the work of equity. Equity says, or in the words of the brilliant and the fierce Dr. Cameron Jones, when she talks about racism, racism is often inaction in the face of need. So equity is rooted in need. So equity says, aha, I will give you ladders of differential height because it will be customized to what it is that community, that group, those identities, the intersectionality of those identities need. Aha, we are on the way to solving the problem. But I ask you to pause. There is still a tree that is skewed or leaning in one direction. Not only is the tree skewed or leaning in one direction, there is still less fruit on the side with the preponderance of the tools and the interventions and the strategies. So I ask you to ask not only of your individual selves, but to ask within the systems, the organizations, within the institutions that you thrive, live, breathe, and exist. What are we doing about justice? What are we doing about fundamentally changing the environment in which the tree grows? What are we doing to make the tree upright? What are we doing so that there would be a plethora or access to opportunity? And we're going to talk about different levels of access, right? Access to care, differential quality in care, okay? But don't forget this graphic because it takes a lot of work to make a tree that's been skewed for centuries, dare I say, upright.